Hello, so before I actually start the vlog, I'm just going to do a little Q&A on why I decided to vlog my journey as well as why I needed the surgery to begin with. So I've been sharing my recovery journey on my TikTok, which is this one. I couldn't find any like Singapore-based creators that were talking about their septorhinoplasty or anything regarding like breathing difficulties. So I was like panicking a lot. So I really hope that this helps people. Why I'm even getting surgery to begin with. I have a deviated septum and I just had a lot of breathing difficulties growing up. So what basically happened is that I had a lot of physical trauma to the face, like running to the glass door as a kid, or like playing really rough with my male cousins. So like a lot of like basketballs or soccer balls would like hit my face because I couldn't dodge in time. One particular incident left me with a deviated septum, which is that we were playing by the pool. I think I was around 7 or 8. He fell into the pool and on top of me. So I don't know if it's his elbow or his knee, but he basically like kneed or elbowed me in the face, and that ended up giving me like a crooked nose. I remember it hurting a lot, but then like I didn't want to make a big deal out of it, especially because I was like the only girl among like my cousins, so I didn't want to like be a crybaby, you know. So I just like went to the jacuzzi and I started like tearing up and I put my goggles on. My dad did realize that my nose was crooked, but he just told me it's okay, like if your nose ends up growing even more crooked when you're older, I'll pay for your surgery. That's literally what he said. He didn't even like say, okay, let's go take you to the hospital. No, he was like, okay, in the future, if it causes you issues, we'll just get surgery. So it ended up coming true. I had to have surgery. Yeah, so basically I fractured my nose. I didn't go to the hospital, so it healed crooked. And later on, I still had a lot of like physical trauma to the nose, like a lot of stuff hit my nose. So then like I had a friend do a septorhinoplasty and turbinate reduction. So I was like talking to her about it. And, like the symptoms that she was describing to me of why she felt like she needed a surgery, it was actually very similar to what I experienced in my day-to-day life. So then I was like, oh, I never really considered the fact that my like shortness of breath was related to my nose, because I always thought it was because I was a very unhealthy kid growing up. I don't like sports or anything, so I would get very out of breath really easily. But I think that the like it is to the point where even when I'm walking with my friend and I'm talking, I can get out of breath because I tend to rely on like quick breaths through my mouth to breathe sometimes. As for surgery costs, it basically costs nothing for me as a Singaporean because one, it's a functional surgery, so it's not like a oh I want to get plastic surgery thing. So it's claimable by insurance because of the fact that it helps to improve my quality of life. Like I couldn't do a lot of things because I was always out of breath, so that's why it was claimable by insurance. Like a big part of it was insurance, and then the remaining like few hundred was paid with my Medisave. So that was kind of my experience with it. It was basically fully claimable. The timeline, I went to go get my nose checked at the polyclinic, I think sometime December 2023. And then I got referred to a specialist. And from there, it was a very, very long journey where I would go in and they would prescribe me a nasal spray because I have like two main issues causing me breathing difficulties. One is my deviated septum, and the other one is my swollen turbinates. Before considering surgery, they would typically try a more non-invasive approach, which would be nasal sprays. So I was basically put on nasal sprays and I would try out for 3 months and I'll come back to do a checkup to see if there's any like improvements. The first nasal spray that was prescribed to me, I forgot the name, but it like caused me a lot of like dryness in my nostrils, so I had to switch to a different brand, which then like basically did nothing for me. So this was like a 9 to 10 month process of like just religiously like using nasal sprays. So then afterwards they finally decided, okay, I think nasal sprays aren't working, so we're gonna consider surgery. And that was when I was referred to my surgeon. So it's currently 30th October, 5:45. I don't know if you can see. I just finished my appointment with a facial plastic specialist. I was referred by my ENT consultant on Monday. So this has been like a 8 to 9 month journey since I first started getting consultations to fix my breathing. The surgeon that did my second nasal scope basically confirmed my suspicion, which is that yes, I have a deviated septum and it's pretty narrow. He was talking about how he would reinforce like it's like some tip support because like it was very weak. And then I have like naturally pretty small nostrils that weren't ideal because of how much I hit my nose and how much it was going down. The tip support wasn't enough. So my already small nostrils like got even smaller. And the way that the doctor described it to me was that the nostrils are like the windows and then the turbinates are the rocks. And now my rocks are kind of too big and my windows are too small. In terms of like what was actually done for surgery, he basically told me to get a septorhinoplasty with bilateral turbinate reductions, reduce the swelling of my turbinates, as well as basically using donated cartilage to reinforce my septum to make sure that it's not deviated. And then he also wanted to raise my tip to kind of enlarge my nostrils a little bit to help me breathe better. In terms of like aesthetic changes, like there wasn't really much done per se. Like of course my nose became a lot higher, but like based on what he was telling me, it was all done with functionality in mind. Actually, he did ask me like if there was any like physical changes I wanted on my nose. Honestly, I just told him I wanted my nose to look like my dad's nose because that was how my nose originally looked like before all the physical trauma. And I think he did a pretty good job because this is my nose now. And he told me after surgery, apparently he shaved a little bit of my nose bump. I really can't tell because like obviously my bump is still there. But yeah, I don't know. Like less than 24 hours until my surgery, so it's currently 11:45. I sound weird because I have a little bit of irritated throat, so I'm eating like a numbing lozenges to help with that, so ignore it. But I'm supposed to fast starting 5 a.m, so basically just like don't eat when I wake up, which is fine. My surgery is at 1 p.m. I have to report at 11 a.m. So far it hasn't hit me yet. Just last night I was a bit nervous. Right now I'm not feeling it much, so I think I'm just gonna take advantage of that and like try and fall asleep. And then we shall check in tomorrow, I guess. But here's a last little look at my nose. Looks like that. I don't really know what to expect, so it's gonna be interesting, I guess. I'm currently waiting for my surgery right now. Okay, my surgeon just consulted me, so I'm like going to surgery soon. I still haven't done IV or anything yet. Getting a bit nervous, but hopefully it'll be okay. Here's a little rundown of like surgery day for you, because obviously I was not in the right mind to take a lot of vlogging clips. The entire process from waiting in my ward all the way to the surgery, they would ask you countless times for your name as well as what surgery you're in for. So constantly I'll just be saying my name is Ashley and I'm here for a septorhinoplasty with bilateral turbinate reduction. They'll just ask you constantly, so just make sure that you remember the name. Initially, from prior consultations, I was told that my surgery would only take 2 hours. So I was like, okay, it's not that big of a deal. But then when we reported to the hospital, they actually told me that the surgery room was booked for 4 to 5 hours. So I was like, 4 to 5 hours? What are you talking about? My friend's experience, she had to put a catheter in because of how long her surgery is, and I just didn't want to experience that. So I was thinking, oh my god, it's a 4 to 5 hour long surgery. So does that mean that I have to put a catheter in too? And after my parents dropped me off, I basically had to go up to the hospital myself, and they showed me the ward that I would be staying in for one night. And I was waiting there for like 2 hours. It was a very painstaking 2 hours, by the way, because obviously I had to fast. I had to fast since 5 a.m, so I couldn't drink any water, let alone eat any food. So like waiting there for another 2 hours, I was so thirsty, but I knew for a fact that I couldn't drink water. So it was like really nerve-wracking, and I was really, really cold. Like I don't know why. The hospital wasn't even that cold, but I just think I was so nervous that I was just like trembling. So obviously after the 2 hours, they finally came to get me, and then I was told to basically move to this like surgery bed thing, and I was wheeled into the observation room. The anesthesiologist basically like was helping me put my IV in, but I think because I was so cold and obviously I was dehydrated from fasting, they couldn't find a vein, so I ended up being just wheeled in to the surgery room to get the IV done there instead. And the funny thing is, they told me like the gas that they told me that they'll be giving me a gas to help open up my veins, to help put the IV in better. So I was just breathing in the gas, and then like the last thing I remember is them like finally finding a vein, and then me thinking like, oh, the worst part is over, right? Because that's the only part where I can really feel the pain. The next thing I remember is like waking up from surgery. So when I woke up, I was like so thirsty and cold, and they also told me that I was running a mild fever, so they were observing me as well. But I do think that it's standard procedure after surgery. I had hot air blowing into this like body bag that my legs were in, because I think I was like so cold from surgery or like having a fever. I'm not very sure. Yeah, and I think I was in the observation room for a good hour, like, and I couldn't drink water like at all until I was wheeled back into my ward. And when I asked for water, it took another like 30 minutes. So like the most uncomfortable part after surgery was mainly just like how dry and scratchy my throat was, and I could barely even speak to tell people like I need water.
I'm so thirsty. I haven't been able to drink water.
I remember like a nurse came in to like help me change from my surgical gown back to my like normal like hospital gown, and then I was just so thirsty I couldn't say thank you, so I just kept like giving her like the heart, be like pointing in her face, so she kind of just like gave me like a, and then like she left. So I think I was definitely still like affected by the general anesthesia a little bit. Yeah, in terms of pain, like I really didn't feel any pain. The painkillers did their job. Like I was just very like, I felt very weak. I basically felt like I was sick, you know, because I had a fever, and obviously like I couldn't breathe through my nose because I had like gauze up in my nostrils, so I could only breathe through my mouth, which didn't help how thirsty I was. So it just felt like you were sick and weak. Yeah.
Okay, I just woke up from an afternoon nap. I changed my gauze already because it was soaked through. I saw online on Reddit and YouTube that instead of taping your face, you can makeshift a mask with makeshift like a gauze like holder by using a mask and folding it up. Afternoon and stuff, I think this is great, so my skin doesn't feel as irritated. I feel so gross. I haven't showered or anything yet. I just like came home and crashed. Like the germaphobe in me is kind of grossed out by that, but I was too tired. My throat still hurt and I couldn't breathe out my nose at all. So the nighttime was a little bit troublesome because I had to keep drinking water to soothe my throat. But it's an aircon room, so I had to breathe through my throat and it would hurt more. So I'll sleep for an hour and I'll drink a lot of water and I'll go to the toilet, and then I'll repeat the cycle all throughout the night. But I managed to sleep, which is great. And then the next morning was a lot better because they pulled out the sponges from my nose. So it felt like they put tampons in my nose and they just yanked it out. And it was like a little bit uncomfortable because my nostrils are really small. But like, bro, the blood and the mucus just gushed out because it was just like all in there. But then like I could breathe a little bit. Now I can still breathe a little bit. Like, I don't know if you can hear it, but yeah. Morning, so it's 9 a.m. I'm eating some soy milk with cereal because I want to eat my medicine so that like my pain meds kick in before the pain starts. Yeah, I managed to sleep like in intervals. Like I didn't get like a full sleep, but I slept quite a lot, which is good enough. I don't know, like when I had another gauze up my nose, like as in like I had like a thicker one. I don't know why, but it was itching, and like at night I kept trying to scratch it. I was like, oh, you know, like I forgot that I can't scratch my nose. So I'm a bit scared that I actually touched my nose last night without knowing. But other than that, it's fine. Yeah, that's an update for you guys. And then I have to wait for my mom to come home, and then we're gonna try the nasal rinse together again. I literally can't like eat without like, I need a mirror because I can't eat because I can't see here. So I have like a mini spoon and then I do that. It's currently Saturday, 5th day. I had the worst sleep of my life yesterday. Okay, it wasn't the worst sleep, but it was definitely the worst sleep among the first week because I managed to flush a bunch of stuff out of the nasal rinse, but then like a lot of it gathered at the end, so it was like completely clogged for me, which was really annoying. Not because I had to still breathe through my mouth, but because whenever I would swallow like my saliva and stuff, I could feel the pressure because like, you know, there was no air escaping anywhere. Yeah, so it was really annoying. And now I'm awake. I already cleaned my nose and like all that jazz. I haven't put the gauze in yet because it's not really dripping that much, so I don't know if I should be putting it in. I haven't done the nasal rinse yet. I'm gonna eat breakfast, eat my painkillers, wait for it to kick in, and then clean my nose again. Okay, so 6 days post-op, I'm no longer putting the gauze down there because it's like not leaking anymore. I have no idea if I have stents in my nose. Up until now, I'm still not very sure, but I'm still breathing through my mouth. Like I can breathe through my nose a little bit, just not enough for me to get a good fresh breath. So it's like, yeah, so it's still manageable. And like, I don't know, like this entire process has been quite okay. I think it's just like it kind of just feels like I have a congested nose. That's about it. I was definitely more worried than I should have been with the whole surgery thing, but it's because I just never had any surgery done before, so I was just really nervous. And my nose is fine, and my IV bruising is still there though. Yeah, I think it was just the most uncomfortable part of the entire thing was just like when I first woke up from surgery, because I was just so dazed, groggy, thirsty, throat was so sore, I was so out of it. I was so cold, and I was running a fever, so I just felt so weak and disgusting. So like, yeah, everything else so far has been great. I'm starting to take less pain meds now because it's been more manageable, but whenever I start feeling a little bit more on my nose, I just take the medicine because I don't want to risk feeling any pain. Yeah, so that's about it, and I've just been resting. I really haven't done anything much at home. I submitted an assignment, but other than that, yeah, I haven't done anything productive. I wanted to do so many things during my 2 weeks MC, and instead I've just been using my phone and resting because I just can't bring myself to do anything else. So if you're thinking you can like clear a lot of stuff while you're down, or they can like explore hobbies, no, you can't. Maybe you can if you're built different, but I can't. I really can't. So I'm just gonna go back to bed now because I'm just tired. Yeah, I'm just tired. I mean, my body is healing itself from surgery, so it's like important to give yourself a lot of grace for that. Even if, you know, it's not a major surgery or anything, it's still something where your body is trying to recover itself. One of the best things that I bought that I don't regret is like frozen soup. Bro, this smoked salmon chowder was so good. So definitely get like some easy to heat up food that's like more liquidy, because sometimes it's really annoying to sit there and like slowly try and feed yourself food and like chew. It gets really tiring, but sometimes you just want to get a meal in. Okay, so it's day 7, so it's officially been 1 entire week, and it's a lot more comfortable now because I can breathe through my nose, and I'm getting my cast off I think in 2 more days. I bought myself an ice cream sandwich because I was hungry, and I deserve it. Like, I want to treat myself. So yeah, but I can't eat it because I can't really move my upper lip yet. So I can kind of pucker my lip a little bit, like, okay, you can't even see it. But yeah, other than that, it's been okay. I think the general anesthesia is fully out of my system by now, so I feel a little less like rocky. Oh, so yeah, that's about it. Not much updates. I just got numbing spray in my nostril, and it feels so weird. It's so bitter. Okay, the cast is officially off. I just cleaned it. They just took my cast off and then like suctioned up some stuff from my nose.
I just want to preface this by saying I'm still really swollen and my tip is kind of high up because it's supposed to drop over some time. And there's also a few pimples on my nose. So 3, 2, 1. This is how my nose looks like for now. You can see I have like this big ass pimple, like 2 pimples here and 1 over here. But this is how it looks like. I'm still so swollen, like there's still a bit of bruising on this side. So I think over some time it's supposed to like calm down. I can't take myself seriously, bro. I can't even recognize myself. I'm just trying not to think too much about it right now. I still can't smile, look. No, I can't smile. I got my HL extended as well, so I'll have to really like take care and recover. Hello. Okay, so it's now 5 p.m. Today is so much less productive than yesterday. Yesterday I finished editing the hard mode vlog, and then I also rearranged my entire bathroom like cabinet. Today I only just started editing the thumbnail for the vlog, and I was checking some uni stuff, and that's about it. That's all I did today. I'm so tired. I don't know why. I look so bad. I cannot get used to this, bro. I'm still not used to seeing my face straight on, so now I'm just like talking like this because I feel like the set profile is really pretty. The front profile is not nice. Yeah, so when I'm sending like telebubbles to people, I'm just like, hey guys, so what's up? Yeah. Oh, this side is fine too, but because I think currently my bridge is super swollen, so I'm just not used to it at all. I don't know why, but apparently like I think I got nicked during the surgery, so I have like a little cut here. Everything's fine. I have no idea how it's gonna look like tomorrow when I wake up. Hopefully it's not gonna be more swollen. I hope that, you know, once the swelling goes down, it'll look a lot more natural, because right now it really looks like really fake, which I really don't like. I'm missing my old nose, but honestly it's like for the best, because like let me just show you. This is how my nose looked like before the surgery. Like this is how my nostrils look like. You can see all the pink. It's like my nasal passage and like my septum in the way of like, you know, where it should just be like darkness. And this is after. Like this is like my current nostril. You can actually look into my nose instead of just seeing like my nasal passage. It's crazy. I just finished cleaning my nose, and like trigger warning, it's really gross, but I just got this like freaking like disgusting old blood clot out of my nose. It looks like a leech, but it felt so good to get it out. Only bad thing that happened today was that when I was trying to get the loose thread burned off, I actually burned my skin along with it, so I have a really bad burn, and you can literally see my flesh. This is me day 12 post-op, and honestly the swelling has gone down so much. I get random spurts of like pain on the inside because I stopped taking the pain meds, and my upper lip is still not moving, but other than that, I'm doing quite okay. It's cool to slowly see the nose start taking like its shape, if you know what I mean. Other than that, not much, and my burn is doing a lot better now. Yeah, that's about it. Okay, so I forgot to add, but I had like a mild fever yesterday, which was day 11 at night. I had like a very mild fever, like 37 point something, and then I woke up today feeling okay, but then now it's like around 3 to 4 p.m. and I'm like feeling very lethargic and like weak, so I'm gonna sleep. I have a little bit of a sore throat, and I just feel very warm and lethargic. I don't know if this has anything to do with the surgery, or I just like have a weak immune system. I don't know, but that's what I'm gonna do. But it's okay, at least my nose looks good. Okay, so I'm 16 days post-op. This will be my final update because I don't think there's gonna be any major changes anymore. My nose has gone down, the swelling a lot, and I would say like my fever is gone now, and my sore throat is almost completely gone. I'm definitely still struggling with breathing when I'm doing like even menial task. So like filming a video where I have to like change a lot of like different tops, I'm like so out of breath. Even when I went to my hair appointment, I was so out of breath. I was going to class today, I was so out of breath. Like, I think my body's still not used to doing any type of labor because the past 14 days I've just been at home recovering and recouping. So the only things that I'm really doing is just like going out of my room to eat, or like going from one room to another room. So it's still a struggle to do that now. So going to work will be interesting because I have to walk a long walk just to go get lunch. So that will be very interesting. But other than that, the nose is looking terrific. I'm still trying to get used to my face. I definitely, a part of me misses my old nose, but I look a lot more like my dad now because this is very close to what his nose looks like especially the side profile of like the very like sharp nose. As long as the front, like it looks a lot more like my dad's nose. I don't know, maybe I'll take a photo and show you on screen here. But yeah, so it's quite interesting that after the surgery I look even more like my dad because I was born with his nose. I just was not very careful with my nose, so I had a lot of incidents where it got hit, and I just had a lot of rowdy cousins. So, and if you're looking to buy anything for this surgery, get very easy to heat up food for yourself. Q-tips are also essential, and if the doctor isn't providing you with any nasal rinse or anything, then I guess you have to buy it as well. And also make sure that you have like clothes that can be like buttoned and unbuttoned, especially like sleepwear, because I did not want to wear anything that I had to put over my head just because my nose was so tender. I didn't want to risk touching it. Also get disposable facial towels because I couldn't properly wash my face for the first few days, so those were really helpful. And even now I don't really want to close my eyes and wash my face because I accidentally like hit my nose. I'm not used to it being so sharp, so I accidentally like grazed it and it hurt, even though it's just like a little soft touch because my nose is just really tender. Yeah, so those are the things that I would say you should stock up on before the procedure. Other than that, yeah, just don't worry too much. Trust the professionals. Give yourself some grace. You're going through a very big difficult change personally. Like, your nose is the focal point of your face. Don't be too hard on yourself during this time. That if you're in Singapore and you have to do this surgery, just know that even as someone who hates pain, I'm such a huge like scaredy cat when it comes to pain. This entire procedure was not painful to me at all. It's just moments of feeling a little bit uncomfortable, and that's about it. So trust the doctors, and if you're really scared, just tell the nurses or the doctors and they will do their job and comfort you because they are terrific at their job. The nurses and the anesthesiologists that I had were very sweet, especially the anesthesiologist. I was terrified and she was the nicest human being ever and comforted me so much that it was just amazing. Yeah, my burn is doing a lot better. It like dried up, and I don't have the bruises anymore, so that's about it. I still have my dissolvable stitches visible. Other than that, everything else is dissolvable, so I don't have to like remove stitches or anything in my nose. Yeah, I hope this was an interesting look into the surgery. I really wanted to film and document it just because I wanted to look back in the process, and I'm currently literally editing the vlog right now. And it's just crazy because sometimes I just don't remember what happened that day. And hearing my updates, I'm like, oh yeah, that happened. I was so out of it during the first 7 days where the anesthesia, like the GA is still in my system. So it's very interesting to watch it back. Yeah, I look terrible in most of the clips, but it's fine. It's fine. It's just to document. This is me like 6 to 7 months post-op, so you can see like a lot of the swelling is gone. You can very clearly see how defined my side profile is, even with the bump, and my nostrils have definitely dropped. yeah, so what they say about your initial like cast removal is very true, that you shouldn't be scared about like how you look like right after surgery, because with swelling, your nostril is gonna look very high up. You're gonna look a little bit like a Whoville person. You're gonna look like you belong in Whoville, but after 2 months, it's gonna settle, trust me. And like every month, I kind of see like small changes with my nose. So it really is a very, very long journey. Even at a 7 month mark, I don't want to say that this is the final end product, because I feel like every month it really does change. So really just give yourself a lot of patience and time for your nose to heal. Um, as well as for the scarring, there's definitely still like a line there, but it really isn't noticeable at all. And I would also say for the movement of my top lip, I only got it back after like 2 to 3 months. And I kept practicing, like, because I can do this, but right after surgery, I really like I couldn't move it at all. So I was basically talking like this, and when I want to like laugh or smile, I had to like do that. So it was a very like awkward phase where I would want to express myself through facial expressions, but I couldn't do it. So that part was a little bit weird. But other than that, yeah, really, please don't worry about it too much. Trust your surgeons. Find someone that you feel like you can trust. And I would advise you to basically like ask your surgeons for some like, pictures of what they're planning to do, as well as some like past surgeries they've done on patients with a similar nose shape as yours or concerns as yours, so that you can really see what you're getting yourself into. Because at the end of the day, even if it's obviously a functional surgery, whatever aesthetic changes they're gonna do for functionality is gonna stay with you for the rest of your life. So it's okay to be very specific with what you want, and to be very like honest about what changes you're okay and not okay with. Because for me, the biggest thing was that I just wanted my original nose back, and I just didn't want to look like I had surgery at all. So I feel like my doctor achieved that, and he also made the entire like process as smooth as possible. So yeah, I hope that this video has helped you a lot. And if there's any other questions that I didn't really address in the video, please just comment down below and I'll find some time to explain to you. That's all. Bye bye!